I'm a doctoral student with the University of Massachusetts Global, and I'll be talking about a project proposal to integrate a medical health application called My Action Planner into a family practice setting. This medical health application, or mHealth, uses self-direction and patient reporting to target areas like sleep, exercise, and nutrition, and it also has an other category where patients can create very specific goal-directed items and gauge them over time to assist with their improvement in health and lifestyle. Now, what's known about the links of sleep quality, nutrition, and exercise? Well, the Centers for Disease Control does know that chronic health conditions have been linked to poor sleep or poor sleep quality. Since 1984, the CDC has also been working with the American Academy of Sleep Medicine and National Association of Chronic Disease Disorders to help mitigate those risks associated with sleep issues, and that patients who do not sleep well are less likely to be motivated to exercise or eat healthy due to the need for elevated dopamine, which they often seek in other ways, such as sugary, high-fat foods. And having poor nutrition will lead to lack of energy to actually pursue cooking healthy or exercising for improved health. And that we know that poor nutrition and lack of exercise are directly related to physical comorbid issues and risk of early death, and that the CDC has been part of a worldwide surveillance team trying to bring research and information on these relationships regarding behavior and social outcomes in chronic disease. The most current CDC statistic that I could find relating to sleep, and we consider poor sleep as less than 7 hours in adults, was from the 2014 CDC website, and it discusses the least number of people affected happen to be people in the Northwest or Midwest, but still anywhere between 28.5 to 31.9% of people in those areas have less than 7 hours of sleep, and the highest being in typically the South or the Southeast, and those are between 38 to 44.1% of all Americans in those areas having less than 7 hours of sleep. These are aggravated by shift work, mental health issues like anxiety and depression, alcohol and drug use, obesity, hormonal changes, smoking, chronic pain which interrupts sleep, restless leg syndrome, and complex sleep disorders like sleepwalking. We also know that poor sleep and chronic health issues are a circular problem, that people who don't get at least 7 hours of sleep have worsening chronic pain, more uncontrolled diabetes, higher rates of stroke and cardiovascular disease processes, higher rates of anxiety and depression, higher levels of obesity, and then safety issues occur between driving, distraction, and accidents have also been related. Now, when we talk about sleep quality improvement, sleep hygiene, which has to do with brain retraining, is very important to help the brain recognize cues that it's time to go to sleep and move into a more relaxed state to sleep, avoiding heavy or spicy meals at least 3 hours before bedtime, because eating close to bedtime also changes the exercise level, and calories tend to turn to more fat. The use of a CPAP machine if obstructive sleep apnea is present to reduce the risk of fatal arrhythmias, treatment of restless legs, exercise and meditation, avoidance of alcohol or caffeine, electronic avoidance 1 to 2 hours prior to sleep, so mental health treatment if needed, and avoiding dependency-causing medications like benzodiazepines, hypnotics or sedatives, and or over-the-counter medications to assist with sleep. Now, with this mHealth application, it also talks about exercise as part of the triad of health, and could exercising 3 to 5 times a week improve weight or sleep quality? Several highly respected medical reviews showed multiple studies that suggest that exercise does provide benefit for both sleep and improved mental health and weight when it's engaged in at least 30 minutes on a daily basis. They used polysomnography in a sleep lab to often measure how deeply they were in REM cycle, and in particular, they talked about using some of the less aerobic exercise kind of exercises to help with sleep and weight management, things like Tai Chi, Qigong, yoga, Bagua, in addition to aerobic exercise, resistance exercise in a chair, or water therapy. They also recommend using good sleep quality index tools like the Pittsburgh Quality Sleep Index or other types in wondering whether or not meditative kind of exercise provides benefit to sleep, and they have found that it does. The third part of this triad was diet, and diet is often the thing that a lot of patients struggle with the most because, and providers, we sometimes just look at the BMI. If they have a healthy BMI between 18 and 24.9, sometimes sleep and diet and things are not always addressed because there's an assumption that they must be exercising regularly or eating correctly and not have any underlying health issues. And that's not necessarily the case. There are people who can have a healthy BMI, but have poor exercise habits and poor diet habits. We do know that poor diet will impact sleep quality and exercise ability for patients, especially if they have excess weight. We recommend having a lean protein, high fiber, low carbohydrate, low sugar diet, unless there's a medical contraindication, in which case something like a patient who's on dialysis may require a very specific kind of diet. However, something excessive like going directly to either a plant-based diet or a protein-based diet can actually make things worse. So we always try to help patients start with moderation in small quantities so that it becomes a longer-term healthy life habit. And the other thing that needs to be talked about that's important with diet is that there are a lot of adults who have dealt with childhood trauma or mental health trauma that has led to adult obesity. Because the part of their brain, the ventral striatal portion, craves dopamine, and that feedback reward they get from eating high sugary diets, which has led to their adult obesity. So it's important to address underlying trauma. Are there social, ethical, and financial considerations? There are. The CDC does state that between 2019 and 2020, over $1.1 trillion was used in the treatment of chronic medical and mental health issues, and that from a social and ethical consideration regarding obesity, sleep, chronic health, diet, mental health, that access is important. If we're talking about exercise and mental health, there has to be the finances to get there. There has to be a safe environment for them to exercise or go to. They have to feel safe with the provider that they're talking to. We do have to treat their other comorbid issues like pain management and other mental health issues at the same time. That's typically the most effective way to do it, but it can sometimes be overwhelming for patients. So you may have to start off slow and work on one goal at a time versus all three at the same time. It's also important to remember that patients who are overweight or morbidly obese often have self-esteem issues, and being out in public or exercising in public, there's been a poor social response that they've been conditioned to, and it can be traumatizing for them. So we do have to be careful in working with these patients and making sure that whatever access or what is recommended is comfortable for them. And then there still is a medical disparity regarding income, gender, sexuality, ethnicity, even in medicine, and that we have to be careful as providers not to bring our own thoughts and concerns into it, and we have to work with whatever makes the patient feel safe, because if a patient doesn't feel safe, then they can't work on any other things other than safety in their life. They have to meet their basic needs of food, shelter, housing, and then safety, and then they can work on greater things that require more time and energy from them. What will this project solve? My hope is that it provides better work-life balance for patients with a mobile health application, that their sleep cycles are improved, which can lead to better blood pressure, increased memory, improved immune system, that they have regular exercise for improved health overall, whether or not it involves weight loss. Sometimes just increasing their cardiac output improves things overall for them. Regularly set aside time for relaxation and meditation, because that's an important part for overall health and well-being in patients. But I also don't want them to substitute an mHealth application for regular care, because the regular care and follow-up is where they can achieve insight, discuss their results, do lab tests, and get referrals for other problems that may occur or be happening at the same time. We need to reduce the health disparity and provide equity and access for all patients through free applications. In this case, they just have to have application access to a phone, a computer, a tablet. I haven't really had very many patients that don't have some sort of access. Even our patients who have addiction issues tend to have some sort of electronic access. Now, the mobile application was initially created by Stanford and released in 2014. It was a bigger part of the chronic disease self-management program that had been in effect since 2001 in Stanford. And I downloaded some pictures that were created from the planner of a particular patient. And this is where the patient sets up a new plan. It talks about when they want to start, what category, whether it's exercise, nutrition, other, how often they want to do it, when they want to do it. But importantly, it talks about confidence level, and it asks for a confidence level between 1 and 10. And the patient will self-rate how confident they are they think that they can achieve their goal. And in this case, these are some of the plans that they had put together, like read a book, avoiding sugary drinks, taking a walk. It also allows them to chart their progress, how often they want to chart it, turn it on, turn it off. But what's really important here, and I find gives the most feedback, are the charts that talk about results. Now, this one has all 6 plans in all categories. But there is a filter available that you can filter out between categories like relaxation or exercise, and it can give you a more specific result. In this case, this patients were all categories, and in all categories, about 50% of the time they were able to achieve their goal, and about 17% of the time they weren't able to achieve it at all. And then the remainder of the percentage was sometimes they made it and sometimes they didn't. It was kind of off and on. As a doctoral student, I applied this application to myself for 30 days. I chose 2 areas. I chose relaxation and exercise, both of which I find difficult to fit into my lifestyle, my category as a student and a provider. And I set my confidence goal for walking and exercise as 5 out of 10. I'm not a real big exercise fan. And my meditation, which for sleep, I set at 7 out of 10 because I work on call a lot and sometimes I don't get the ability to really spend the time meditating like I should. I split my filter into looking at the physical activity and the relaxation separately, and I was able to find that over 30 days, I was able to complete the goal 100% of the time, which means I did it every day and updated it every day. And then I found that I lost 7 pounds during the physical activity, and that I was able to improve my sleep after about a week or so by about 1 hour minimum per night. Who were my collaborators? There was myself. I talked to a medical director to see if family practice would be a good setting to fit this mHealth application and education, if it was, a reasonable thing to do for his patients and his population. I spoke to a licensed clinical therapist to make sure I wouldn't be activating or worsening any trauma, and how to deal with that with some patients and how to guide them. I also talked to an exercise physiologist in cardiac rehab who works with medically frail patients on how to start them off low and slow on exercise and how to guide them correctly. A registered nurse in the emergency room to talk about continuity of care and appropriateness of initiating conversations about using medical health applications, even in the ER, with basic questions like, do you use a medication application to make sure you take your medication every day? And then I also have a back office manager who would be integral in dealing with referrals, finances, marketing, and sometimes even additional education and uploading of documentation into the patient's files. The tips that we came up were really about making sure that we had something for them to use in both English and Spanish, that we provided extra education to the elderly clients, that we made it easy for the patients to send their information to be uploaded into their charts, to talk about these things on a regular basis and follow up, to incorporate extra teaching time into our billing if it was available, especially with Medicare patients, making sure that we link them up with additional services or sleep studies or any underlying treatment issues, treat addiction, and provide safety in terms of gender, sexuality, and ethnic specific providers if the patient has a preference. I think it's innovative because I think that patients can drive their care, they can build their care, and it's fee-free, and it reinforces through goal achievement. I hope this was helpful, and I hope that this can be integrated into your family practice. Here are my resources, and thank you.